Research shows LDL cholesterol is an important modifiable risk factor for patients at risk of a cardiac event. I'm here at the American Heart Association's 2023 Scientific Sessions, joined by Dr. Nihar Desai, cardiologist at Yale Medicine. And today we will be talking about why lower is better when it comes to LDL cholesterol in patients with ASCVD, and also talking about why frequent testing is so important. Dr. Desai, thank you so much for joining us. And if you could tell me why, or talk to me a little bit about the aspects of routine clinical practice that might be contributing to the undertreatment of LDL cholesterol.
Yeah, it's a great question. I think what we know is, obviously it's hard to overstate the public health burden of cardiovascular disease, both in the US and frankly around the world. And we know that LDL cholesterol is one of the most important, if not the most important, modifiable risk factor for vascular disease. I think too often we see that too many of our patients are not actually getting to the LDL levels and are not being managed and treated with the evidence-based therapies that the guidelines or other professional society statements would suggest that they be on. I think there's lots of things that probably contribute to that. I think engaging patients, having them know the importance of LDL cholesterol as a modifiable risk factor is critically important here. I think providers have a sense of inertia. We're not intensifying treatments in the way that the guidelines and other documents are suggesting that we do. We're underusing highly evidence-based therapies. And I think those two things together are really leading us to where many of our patients are not getting to the LDL levels that the guidelines and the expert consensus decision pathways are recommending.
How can patients really benefit from routine testing?
Yeah, testing is a really important foundational part of this. We can't get patients to the goals and the levels that the guidelines and the expert consensus decision pathways are advocating for if we're not even doing testing. I think more than half, if not as many as 3/4 of patients following a heart attack are not getting their LDLs tested. And so there's a really critical role that all of this begins with LDL testing and making sure patients know what their LDL cholesterol level is. And that's the start of a discussion, we hope, with providers about, hey, what's the right level of LDL that they should be getting to?
And how can healthcare providers really communicate the importance of maintaining those levels low and also keep patients motivated to adhere to those treatment plans?
Yeah, it's a critical question. I think we all have a role to play in that as part of the healthcare team. And I think we've got to continue to emphasize to patients that LDL cholesterol is really one of the most important, again, if not the most important, causal risk factor for vascular disease, and that lowering levels of LDL has been shown to reduce the rates of adverse cardiovascular events. And so one of the most important things they can do from a cardiovascular health and cardiovascular prevention standpoint is to lower that LDL cholesterol.
Dr. Desai, thank you so much. Pleasure.
Thank you.